The term leukemoid reaction describes an increased white blood cell count, or leukocytosis, which is a physiological response to stress or infection. It often describes the presence of immature cells such as myeloblasts or red blood cells with nuclei in the peripheral blood. It may be lymphoid or myeloid. Definition and diagnosis. Conventionally, a leukocytosis exceeding 50,000 WBCM3 with a significant increase in early neutrophil precursors is referred to as a leukemoid reaction. The peripheral blood smear may show myelocytes, metamyelocytes, promyelocytes, and rarely myeloblasts. However, there is a mix of early mature neutrophil precursors, in contrast to the immature forms typically seen in acute leukemia. Serum leukocyte alkaline phosphatase is normal or elevated in leukemoid reaction, but is depressed in chronic myelogenous leukemia. The bone marrow in a leukemoid reaction, if examined, may be hypercellular but is otherwise typically unremarkable. Leukemoid reactions are generally benign and are not dangerous in and of themselves, although they are often a response to a significant disease state. However, leukemoid reactions can resemble more serious conditions such as chronic myelogenous leukemia, which can present with identical findings on peripheral blood smear. Historically, various clues including the leukocyte alkaline phosphatase score and the presence of basophilia were used to distinguish CML from a leukemoid reaction. However, at present the test of choice in adults to distinguish CML is an assay for the presence of the Philadelphia chromosome either via cytogenetics and FISH, or via PCR for the BCR-ABL fusion gene. The LAP score is high in reactive states but is low in CML. In cases where the diagnosis is uncertain, a qualified hematologist or oncologist should be consulted. Causes of leukemoid reaction. As noted above, a leukemoid reaction is typically a response to an underlying medical issue. Causes of leukemoid reactions include hemorrhage, drugs, use of sulfa drugs, use of Dason, use of glucocorticoids, use of GCSF or related growth factors, or trans-retinoic acid. Infections, Clostridium difficile, tuberculosis, pertussis, infectious mononucleosis, visceral larva migrans. Asplenia, diabetic ketoacidosis, organ necrosis, hepatic necrosis, ischemic colitis. As a feature of trisomy 21 in infancy, as a paraneoplastic phenomenon. References. See also, neutrophilia, leukocytosis, Leukemoid.